The Honourable Sophia Mormont.
Thank you, President. So I spent some time in Berlin recently. I had been invited to participate on 2 panels there at a global health summit, one relating to drug policy and one relating to COVID. Due to the kind gesture of the Honourable Wilson Tucker, I was able to swap my dates for motions and able to attend, so that was exciting. To be honest, it was a bit of a highlight of my political career, buoyed further today by my motion being supported by the government. Whilst there, I visited a safe injection room where I learned more about the systems of safeguarding that they have in place in Berlin. So users can buy cheap needles and syringes from vending machines around town. Users can also have their substances tested, and the centre itself has a full-time social worker guiding people to suitable services where needed. They also have 3 vans providing mobile services too, which seems like an approach that may well work here. It is a way of circumventing community hesitance of providing these types of services in neighbourhoods. Now, they have the same biases there against drug users that we have here too. People don't choose to become addicted, and addicts aren't single individual units with no connection to community and society. They are mothers and fathers, they are someone's child, and they have family and friends. By providing support services, it frees up time for those addicted to focus on their lives and hopefully at some stage have the physical and mental, emotional resources to go through withdrawal. Now, Germany has similar drugs entering the country, and meth is now one of the most commonly drugs there too, versus heroin, which used to be much bigger before. Now, the issue that we're dealing with there is the cutting in of other substances is really problematic. And we talk about nitazines there. They're very potent, so you don't need much of it. And that makes it easy to overdose on them. So people aren't necessarily wanting to use this, but they are added to other substances like heroin, cocaine, fentanyl, and MDMA. Now, whereas most overdoses with opioids can be reversed with 1 dose only of naloxone, these new substances require multiple doses. And obviously that's adding to the amount of people that are dying from drug overdoses. Now, prohibition is failing, and I fear that we will see an increase in accidental overdoses here too. We need strong regulation here based on the reality that these substances are now here. Now, whilst participating on this panel with drug policy experts from around the world, it came up that a decriminalisation model, as in what Portugal has, and pill testing are 2 very effective methods in preventing overdoses and addictions. I would love to, at some stage, see some of these things implemented here in WA, because from what I'm hearing from various sources is that we are dealing with an increase in very dangerous substances here, and people will lose their lives, basically. Thank you.